participating with you in this event. Let us starting our meeting about the latest data of multivitamin brain health. We heard the interesting lecture of Dr. Rana, how she highlighted the role of different vitamin B, vitamin D, other antioxidant brain health. Let us give some deep dive on the latest published data on this topic. First, let's take one step backward and describe what is cognition, what is memory, what is executive function. The mild change in cognition can be part of normal aging process. Episodic memory and executive function are considered cognitive abilities that are critical for everyday life, and decline of these domains are seen normally by aging, and also is seen associated with some diseases like Alzheimer, dementia. Coming to two very important terms which we will discuss in the coming slides, episodic memory and executive function. Episodic memory draws upon the ability to encode, store, and recollect recent and past event or experience. Example, remember where you parked your car this morning or what you did in last year for your birthday. Executive functions is a complex multi-component construct that includes a range of different processes that are necessary for performance of everyday function. This process includes planning, organization, coordination, and evaluation of many non-routine activities. Multivitamin and cognitive function. As Dr. Rana have highlighted, while many studies have examined the effect of single or selected combination of nutrient, variety of dosage over varying time points, few have studied the effect of broad-spectrum multivitamin on cognitive function in older adults over long duration. To date, the only large-scale randomized double-blind placebo-controlled trials that study the influence of multivitamin in cognitive function and the mood in elderly were mainly three studies: Physician Healthy Study Phase 2 trial, the Cosmos Mind trial, the Cosmos Web trial. Looking in some details of this study, all these studies was conducted as large long-term randomized trial. Investigator was done in Harvard and Columbia Hospital, Wake Forest University. They were conducted in large population in 5,000, about 6,000 male physician for physician study. Cosmos and Cellus trial, both of them combined more than 5,000 subjects for very long duration, starting from 11 years up to 3 years. And we will deep dive more in the coming slide about more data about Cosmos studies. Cosmos study is discuss the effect of cocoa extract and multivitamin cognitive functions. These are two independent clinical trials to assess the effect of multivitamin. In our case, it was Centrum Silver, the USA formula, and global cognition and memory. Cosmos Mind, which was done on 2,262 participants, considers the first large-scale long-term randomized control trial, effect of multivitamin mineral supplement and cocoa extract and global cognition. Cosmos Web is another large-scale long-term randomized control trial to examine the effect of daily multivitamin mineral Centrum Silver on memory in older adults, with 3,562. Both these two studies are ancillary studies of the large Cosmos trial, which was done over about 18,000 participants to assess the risk of cardiovascular disease and cancer. So, what was the result of this study? First, before going to the result, this study, as we said, the objective of Cosmos Mind study to assess three items: the global cognition, episodic memory, and executive function, all in subject above 65 years over 3 years. The Cosmos Web was compared to examine the effect in episodic memory in subject above 60 years for also 3 years. Multivitamin Centrum Silver significantly improved the memory in older adults. This was the result, as we'll see in the coming slide. In Cosmos Mind study, the results, there was significant improvement in the three global cognition, episodic memory, and executive function over 3 years over placebo, while cocoa extract didn't show any significant result. So the question, what does this mean for a patient? This means that Centrum Silver or multivitamin helped to slow cognition aging by 60%. This is very strong data, and this data was published in 2022 in the magazine, the American Journal of that published in the Alzheimer and Dementia magazine. Very strong data to support the role of multivitamins in elderly. In Cosmos Web, also we received the same significant result. Over 3 years, there was significant improvement in memory compared to placebo. Also, the question arises, what does this mean for a patient? This means that daily use of Centrum Silver was estimated to improve episodic memory performance by 3.1 years of age-related changes. This was calculated in a model where they calculate the decline of memory while aging compared with the arm who take Centrum Silver. This also was published in 2023 in the American Journal of Clinical Nutrition. So it's time to think again about multivitamin. As we said and one discussed, I think in our day, micronutrients are critical to the whole body health. But unfortunately, about 50% of us aren't getting what our need from food alone. Centrum Silver improved the cognition performance in two randomized control trial with combined number around 4,463 subjects. Centrum Silver in Middle East contains the same B complex vitamin and antioxidants such as vitamin C, E, and zinc, which was proven by the Cosmos studies that they have significant positive effect in global cognition, older adults, and in memory and episode.